Welcome to Majestic, where our motto is quality care for every patient, every time.
Majestic Hospice is an organization that is owned by two nurse practitioners with more than 20 years of experience combined. We started in an ICU setting, inpatient, and we are now transitioning into the hospice world because we understand the importance of transitioning or dying with dignity.
When we embarked upon trying to figure out what we wanted for our logo, it really had to have meaning behind it. And it had to incorporate who we are as clinicians and what we wanted to bring to the hospice world and actually to healthcare in general. So the logo itself comes from the idea behind the tree of life and living life to the fullest.
My portion of the logo is the heart because my specialty is cardiology and cardiovascular ICU. And so we take care of patients, who have had heart attacks or open heart surgery or congestive heart failure.
The brain there symbolizes my background in neurocritical care and working with those individuals who've had any type of deficits in the brain. Our goal is to enhance what people already know about hospice and make it our own. And we really want to maintain the world of hospice and show that the stigma that's connected to it is not a stigma at all. We want our patients to transition peacefully. And it makes us different because we want to take that experience and really make sure that we can be the best of the best.
It came about because of my experience, with my own mom and her transitioning with hospice care and feeling like there were so many opportunities in terms of the level of education.
I think the decision for hospice for the both of us, including myself, was an easy decision to make. My grandma passed in hospice in 2017. As a family, we had to collectively get together to decide, would we do an inpatient hospice or would we do a home hospice? After thoroughly thinking about it, home hospice was the way to go.
We were glad that we were able to be there when she transitioned. We were glad that we had those last seconds. When you have family members that may be singing or holding hands or praying, we got to experience that without the coldness and sterility of a hospital.
We've been on both ends. We have been caregivers for patients that are preparing to transition to hospice, and we have had family members that have had experience in hospice and have transitioned in hospice.
So when I chose the career of nursing, I did it because I wanted to help. I wanted to just be there for people when they're very vulnerable and just needing support and care, and I've certainly done that as a nurse. However, sometimes I feel like we can't do much, but we can do something different.
We understand that there is a breakdown with minority groups and hospice.
I want to be able to facilitate that for everyone, and especially for my community, my Hispanic community, that I feel like we sometimes don't consider that as an option. We think that taking that route is giving up, but it's not. It's just taking a different path, one that will allow you to have good memories and be with family.
The goal of Majestic is to provide excellent customer service. We know that with hospice currently, the expectations are pretty low. Not sure when nurses are coming. The education is lacking. So at Majestic, we will provide excellent customer service. We will provide education, and we really just want to bridge the gap.
We want to bring all that we have. We want to bring love to families. We want to bring support to families. We want to bring care to patients and families. We feel like this is about everybody, not just the patient. There's no other way. Majestic is the way.
For all of your hospice needs, call 1-800-HOSPICE.